Hi, I'm Dr. Jonathan Rogers. I'm a private dental practitioner of 45 years experience, and I practice in North Adelaide, South Australia. When I first started in practice many years ago, I realised that people were avoiding going to the dentist through fear and trepidation. I realised that there was a better way of treating people rather than doing a multitude of local anaesthetic procedures. Get in there with sedation, you could do a lot of treatment for people comfortably because it removes reflexes such as a gag response. Fear is completely removed, anxiety is removed. People are not aware of what's going on, they have no memory. We still use local anaesthetic, but it's a very comfortable way of doing treatment. Basically, IV sedation involves putting an IV line or an intravenous line into a vein in the back of the hand or in the arm, and then a fully qualified anaesthetist is engaged to introduce the drugs, and they're monitored throughout, the patient's monitored throughout the procedure by the anaesthetist. That's probably the biggest one, that patients are not aware of what's going on, but it's really good for people who have a gag problem, people who've got medical complications. Some physically and intellectually disabled patients are very good for IV sedation, but they need to be pre-assessed by the anaesthetist and by us. Restrictions would be people under the age of 10 or over the age of 85. Not you can't do it, but they need to be carefully assessed. Pretty well anybody within that age bracket can be treated. Well, general anaesthetic, you have no of your own swallowing or respiratory reflexes. You're completely under the control of the anaesthetist. In our hands, under sedation, the anaesthetist still has control over all that, but you as the patient can still breathe, swallow and respond to verbal commands, even though you're not aware of being asked to do stuff. It's as safe, if not safer, than general anaesthetic. It's a lot less complicated than going into a hospital and being managed overnight. Once the IV line goes in and the drugs are introduced, it's like having 10 gin and tonics.